Hello everyone, our next MP topic is femoral artery. So we are now going to learn about the femoral artery. We had seen something about femoral artery in femoral triangle, which was our previous topic. In femoral triangle, femoral artery gives three branches, superficial branches and three deep branches. Now we are going to getting knowledge in a deep way of a femoral artery. So femoral artery has a origin, extent, course, relation of femoral artery, then branches of femoral artery and clinical anatomy of the femoral artery. So femoral artery, we can say that chief artery of the lower limb. Now comes to the origin of the femoral artery. This figure shows the origin of the femoral artery or the continuation of the femoral artery. First, origin of femoral artery. It originates behind from the inguinal ligament. It origin from the behind from mid-inguinal point. This is the mid-inguinal point, and artery origin behind from the mid-inguinal point, and this femoral artery is a continuation of the external iliac artery. See this figure. This is the descending aorta. It divides into two branches. First branch name is common iliac artery. Then common iliac artery divided into external iliac artery and internal iliac artery. Then external iliac artery is continue in the femoral artery. So we can say that femoral artery is the continuation of the external iliac artery. So now comes to extent and course of femoral artery. Femoral artery passes downward and medially. Femoral artery, so this figure. Femoral artery passes downward and medially. First in the femoral triangle, it passes through the femoral triangle, then in the adductor canal and open into the adductor magnus muscle, and then become continue as a popliteal artery which supply the blood of the popliteal fossa. So this whole extent of the femoral artery, first it origin from the mid-inguinal point, then it passes downward to the femoral triangle and then continue in the adductor canal and then adductor magnus and then continue in the popliteal artery. Relation of femoral artery. Anteriorly, artery covered by the skin, superficial fascia, deep fascia and anterior wall of the femoral sheath. We had seen that femoral vessels cover with the femoral sheath. So femoral artery nearly comes to relate with the femoral sheath. This one is the femoral sheath and this femoral vessel. So anterior relations are skin, superficial fascia, then deep fascia and the anterior wall of the femoral sheath. Posteriorly relate with the floor of the femoral triangle, and in the floor of femoral triangle comes to the muscles vas major, pectineus muscle and adductor longus muscle. We had seen in the femoral triangle there are made up of the four muscles of floor of femoral triangle: adductor longus, pectineus muscle, iliacus muscle and this vas major muscle. So artery relate these three muscles in the femoral triangle. Now comes to the medial relation of the femoral artery. Just below the inguinal ligament, the femoral vein is medially to the artery. However, the vein gradually crosses to the lateral side to lie posterior to the artery. So, medial relation of the femoral artery, just below the inguinal ligament, it medially relate with the femoral vein. This one is the femoral vein, and femoral vein gradually passes downward medially to the femoral artery and then pass downward and posteriorly to the femoral artery and crosses posteriorly to femoral artery and lies laterally in the lower part of the femoral artery at the apex of the femoral triangles. So this figure shows the medial relation of the femoral artery. This is the femoral vein. First it passes medially to the femoral artery, then at the midpoint of the femoral artery it crosses posteriorly to femoral artery and comes laterally to femoral artery in the lower part at the apex of the femoral triangle. So this is all about the medial relation of the femoral artery. Then lateral relation. Laterally of the femoral artery relate with the upper part of the femoral artery relate with the femoral nerve, and lower part of the femoral artery relate with the femoral branches of the femoral nerve. This one is the branches of the femoral nerve relate with the lower part of the femoral artery, and upper part relate with the femoral nerve. Then comes to branches in femoral triangle. Femoral artery gives 3 superficial and 3 deep branches in femoral triangle. So superficial branches are superficial external pudendal artery, then superficial epigastric artery, superficial circumflex artery. Superficial external pudendal artery supplies to the skin of external genital organ, and superficial epigastric artery gives supply to the fascia and skin of the anterior abdominal wall. Superficial circumflex iliac artery is supply to the skin along the iliac crest. Then deep branches. Name of the deep branches: profunda femoris, deep external pudendal, which supplies the external genital organ, and then muscular branches. This figure shows the branches of the femoral artery. So this one is the superficial branches of femoral artery. This is the superficial epigastric branch of femoral artery. This one is the superficial circumflex branch of femoral artery, and then superficial external pudendal artery. Then comes to the deep branches of femoral artery. This one is the deep external pudendal artery, then profunda femoris artery, and this smallest one is the muscular branch of femoral artery. Muscular branch of the femoral artery. So these 3 are the superficial branch and these 3 are the deep branch of femoral artery. Now comes to clinical anatomy of femoral artery. Femoral artery can be compressed between the mid-inguinal point and head of the femur bone, and it can stop supply of the blood to the legs or thigh muscles. Then pulsation of femoral artery is mostly common palpable in the mid-inguinal point against the head of the muscle. It is the most palpable pulsation after the carotid artery and the radial artery. If there is a bilateral absence of pulse, then can be diagnosed as a thrombosis, clotting blood of aorta, and narrowing of the aorta. Bilateral absence of pulsation means both sides of the femoral artery can not getting same pulsation of the femoral artery, so it called bilateral absence of pulsation or feebleness of the femoral pulse. Then if there is a injury through the step wound of femoral vessels result in the fatal hemorrhages. It can be hemorrhage in the femoral vessels. Then comes to femoral vein, commonly used in the IV fluid insufficiency in the infant or in the patients of the circulatory heart failure, peripheral circulatory heart failure. It can be used in the IV fluid infusion. Then femoral artery is the most common use in the catheterization in the minor operation of heart, and femoral artery is quite superficially in the femoral triangle, so it can be easily exposed for ligation like tying or for passing or cannula or the thick needle. Catheters are passed upward till the heart for certain minor opening, so we can say that it used as a catheterization in the minor heart surgery. So this whole is the clinical anatomy of the femoral artery. So after completing this topic, I will provide my notes, so you can take screenshot of this note and write down in your university exam, so you can get good marks in your exam. And then in exam, this figure is most draw in your exam. So thank you all of you.